I'm Dr. Deborah Taylor. I am core faculty at a community residency program for OBGYN. One of the reasons that I choose to work with resident physicians is because the opportunity that I have to make a difference isn't just in that patient today coming and being heard. It's also in modeling that behavior for the doctors I train so that they know that when you get out and when you're taking care of patients, listening is such an important part of what we do. I went through this implicit bias training 2 years ago and really had the opportunity to say, even though this is really important to me and I think I'm doing a great job, there is room and ways for me to do better. It was split. It's a 2-week training. You do a half day and then a week later you do another half day. And so in between those sessions, I had a patient who had come to my office and was very upset. She had thought she was getting an ultrasound and I had said she didn't need one. I said, hey, I looked at your records. I don't think we need another scan. I think we got the information we need about your pregnancy. And she said, well, that's not what I'm worried about. And I said, oh, okay, tell me what you're worried about. And so we talked about her bleeding and got through it. And she actually did end up getting another ultrasound. And I didn't think anything else of it. And then that second day of training, as they asked us, think of different ways you've interacted with people, I had this moment where I was like, oh my gosh, I missed the point. Because what she had said was she wasn't worried about the pregnancy, she was worried about her. What she was saying was she was worried about the bleeding, that it was going to be dangerous for her. And I really felt awful to the point that I called her. I was thinking about you in the office the other day and I just wanted to check up on you and make sure you were doing okay. She said, oh, I'm fine. Thank you so much for calling to check on me. And I said, and I just wanted to make sure I reviewed that if you had any more bleeding, that you can always come back to the office or call us or go back to the ER. And she said, okay, I know that. Imagine my surprise when she reached back out to me the next day and said, I really wanted to say thank you for that call because I've never felt more like someone really heard what I was saying. And I've never had a doctor call and check on me. So thank you. So the changes that you make don't have to be big and broad. They can just be the little ones every day, right? Taking that minute to make sure that you're here. Taking that minute before you walk into the office to really take the opportunity to remember, okay, it's a new day. I have every chance to make a difference for the patients that I care for and the doctors that I train. Hear her. It could save a life.